Hi there, I'm Dr. Chung, and welcome to your friendly proctologist. Thank you so much for being here with me. I appreciate your time. I just want to tell you that online consultations are going extremely well. I'm so glad to meet every single one of you. And if you're interested in having a video consultation with me, then please look in the description box. Just email me at yourfriendlyproctologist@gmail.com and I will send you all the details that you need to know in order to get to the time to meet with me. Okay, so let's get to the question for today. The question that is asked is actually, well, it's a pretty frightening topic. You know, no one ever wants to get anal stenosis after a hemorrhoidectomy, right? I had a video about anal stenosis describing what that is. I just suggest you look at that video first so you know what it is. But the person is asking, how do you prevent anal stenosis after the hemorrhoidectomy surgery? So there isn't a very good way to answer this in a way that's very reassuring, okay? Because number one, I've got my handy list here so I don't forget to mention something. But the number one way to really prevent anal stenosis or to not get it is dependent on your surgeon's technique. The way the surgery is done is primarily how people can end up with that complication, okay? And it's out of your hands is kind of what I'm saying. The main issue is that when you are doing the hemorrhoid surgery, removing the largest hemorrhoids, right? But some physicians, what happens in this complication is that you remove too much of the lining inside the anus. And then the body heals by scarring down. And when you don't have normal lining left, it contracts down to the size of a pencil hole and it all becomes hard tissue or scar tissue there. And that's where people can get the teeny tiny little buttholes that you can't poop through it. There's tons of pain, etc. Okay, so number one, it's very important that I recommend a specialist. I'm biased, but at least a surgeon who has a good track record and knows what they're doing when they're doing a hemorrhoid surgery. Okay, someone who's done a lot of these and is gotten good results with patients. Okay, what about number two? Well, the other risk factor of getting anal stenosis is patients who get surgery under emergent conditions. Okay, and the biggest thing here is people who have an emergency with hemorrhoids, and the emergency condition is called incarceration, and I'll spell it down below, okay? But this is a problem where your hemorrhoids actually die, okay? They're so swollen and stuck on the outside of your body, coming out and prolapsing out, that the tightness and the tension there cuts off the blood supply and the hemorrhoids actually start dying. Okay, this is a life-threatening scenario because you can get infectious complications from this. And when this is recognized in the hospital, the answer or the treatment is to do a hemorrhoid surgery. Okay, but when your hemorrhoids are that big and everything's all swollen, this is higher risk. And in these situations, it doesn't really matter if you have the best surgeon, okay? Because some of the hemorrhoids that the surgeon didn't remove, that can die and create scar tissue. And so that's where your risk of getting anal stenosis is really about trying to take care of hemorrhoids so that you can prevent this from happening, okay? And so recognizing how to take care of your hemorrhoids and realize when there's a problem before it's too late can really be helpful to battle that condition, okay? The other thing, number three, is if you're getting a hemorrhoid flare, just get it checked out and see if you can manage, see if you can get over the flare with traditional methods, with medications, and not with surgery. The flare makes your hemorrhoids huge, right? They swell up, and that's what makes things painful and really bothersome, and you can't move anywhere, you can't do anything, right? And well, if you were to choose a surgery route, this is where you're again at higher risk. The hemorrhoids may not be dead like in incarceration, like I just spoke about, but because they're so swollen, the surgeon may be tempted to remove too much of your inside lining and then place you at risk for anal stenosis because not enough inside lining is left to heal properly, okay? So if you can, excuse me, if you can wait or at least try to manage before you do a surgery option like that, then I would encourage that to wait until things calm down, things will shrink down, and therefore the surgeon won't be as tempted to remove too much. I think that in those cases, surgeon experience, surgeon training can be very helpful to combat that, so that if you are having a flare, the surgeon can handle it either way and not cause this complication. All right. What about if you, let's say your surgeon, you know, there was conditions that you couldn't help. The surgeon did the best he or she could, and now it seems like things are getting very tight down there. You're very concerned. Maybe the surgeon even told you, oh no, you're developing anal stenosis, okay? Let's think about that God forbid situation, right? And so here is what's recommended at those points. It's very hard to do, okay? These are more easier said than done. Why? Because you're usually going through the recovery. That's the best way to catch it, right? If you can stretch things out before the tissues scar down and tighten up and harden, then perhaps you may be better off than doing it after everything heals. But what does that mean? That means you're doing things while the cuts are all still there. Ooh! I mean, you just don't wish this kind of thing on anybody, all right? So the first thing is that dilating your bottom end, your anus yourself, okay? People may use their finger. People may use actual medical device dilators. This is where I would speak to your surgeon about getting some equipment to help you or some strategies to help you gently stretch out your bottom end. Usually pooping, that in itself stretches out your bottom end, right? But the thing is that you may not be pooping very often. Maybe you poop once every other day, for example, or even once a day. That may not be sufficient enough to combat this. And if you're trying to do everything that you can, and that's these strategies I'm bringing up to you now, okay? But dilating on your own would be one way. The thing about the scar is that it's not just it gets hard and everything like that. It contracts down, so it pulls on itself and it brings the hole even smaller after you finish healing, okay? You know, you see a bunch of people's wounds on their arms and they have a big cut there. The skin is like wrapped around tight. And that's kind of what the same thing that happens to the anus, okay? So sometimes in desperate measures where you're having trouble pooping, your poop is like a shoestring because it's so thin, or like a tiny little noodle, and doctor says, oh, you have anal stenosis. The two options at that point are mainly surgical, okay? One is to actually put you under anesthesia, where you're out and you don't feel any pain, and the surgeon will actually manually stretch you out. They'll use instruments in the operating room and gently, gradually stretch out the scar tissue. So that way you can go from a very small hole, and you couldn't do it yourself at home because it was so tight and so painful to stretch it out. But when you leave the operating room, your bottom end is much more wide and things can be so much more comfortable for you to poop out of, okay? It's possible you may need that procedure to stretch out your bottom end several times a year, maybe once a year. It all depends on how bad things get and whether you want that procedure done again. The other thing that is another procedure is called anal flaps, anal skin flaps. So the scar tissue inside the anus is the problem, but the way this procedure works is you bring in the skin from the outside of your butt cheeks, right? Outside of your anus, on your butt cheeks, and that is all soft and stretchy. And you essentially bring that in and stitch it inside of your anus so that you can restore some of that flexibility back. It's a very tough operation. The success rate is quite questionable. It ranges quite a bit, and it's because I believe because of surgeon experience. I'll tell you straight out, I have not done one of those procedures. I will not do any of those procedures because I don't have the experience. I don't want someone to go through something like that under my hands just as an experiment, just because I read in a textbook. I believe that something like that should be done at a very experienced academic research large center, doctor who's seen these types of cases, so that you have the best chance of healing this and solving your anus stenosis or improving your anus stenosis issues. So I hope this video helped in understanding and how to prevent the best that you can, or what the situation is like if you're going to develop anal stenosis after a hemorrhoidectomy. I hope I didn't scare you too much in this video. Like I said, anal stenosis is very, very difficult. And so let's keep the questions coming, let's keep the discussion going, and let's keep this community going strong. Thank you so much. I hope you have a good week. Take care. Bye-bye.